All right, today we're diving into a really important story. It's about a crisis that's happening right now, kind of hidden in plain sight inside our hospitals. It's about the very people we trust with our lives. And believe it or not, a potential solution that comes from a place you would never, ever expect. We're talking about how to heal the healers themselves. So that brings us to the big question we're exploring today. Can ancient wisdom, a philosophy that's literally thousands of years old, actually help with the insane high-tech stress of a 21st century emergency room? It sounds a little out there, right? But stick with me, because the answer is pretty incredible. Okay, so before we can really get the solution, we have to understand the problem. And to do that, we need to step into one of the most intense places on Earth, the modern ER. It's a place where miracles happen, for sure, but those miracles take a huge, unseen toll on the people making them happen. Just try to imagine this for a second. Your entire day, every single day, is about life and death decisions. Every single thing you do has this enormous weight to it. The pressure never stops, the stakes are as high as they get, and there is zero room for a mistake. That's the kind of stress you don't just leave at the office when you clock out. And living with that kind of pressure, day in and day out, well, it leads to some really serious consequences. First, you've got burnout, which is just that feeling of being completely physically and emotionally drained. But there's also something else called moral distress. This is a tough one. It's that awful feeling a doctor gets when they know exactly what a patient needs, but for some reason, maybe it's hospital policy, maybe it's insurance, they can't do it. All of this just adds up to a constant, grinding struggle to find any kind of inner peace. So how on earth do you even start to fix a problem that runs this deep? Well, this is where things get really interesting. This is where two worlds that you'd think have absolutely nothing in common come crashing together. So on one hand, you have what's called advanced cardiac life support, or ACLS. This is pure hard science. It's all about algorithms, strict protocols, and high-tech procedures to save a life. It's precise, it's rigid, and on the other hand, you have the Bhagavad Gita. This is an ancient Hindu scripture, a deep philosophical text, all about doing your duty, taking action, and somehow finding inner calm right in the middle of total chaos. You've got science and spirituality, structure and soul. So who in the world could build a bridge between these two completely different worlds? It would have to be someone who truly gets both of them, inside and out. And that brings us to the person at the very heart of this story. Meet Dr. Satish Bhardwaj. Now, what's so important to know is that he isn't some philosopher who got interested in medicine. No, he is a frontline, in the trenches, emergency physician. He has lived and breathed that high-stakes world we were just talking about. And we're not talking about a little experience here. We're talking about 30 years of experience. 30 years. That's 3 decades of seeing absolutely everything and understanding on a really personal level the toll that it takes. And it's from that really unique perspective that he created something totally new. He calls it code wisdom. It's basically an approach that weaves the ideas of the Bhagavad Gita right into the stressful, split-second practice of saving lives. Let me put it this way. One of the main ideas in the Gita is to focus on your duty, to do your work with total excellence, but to detach yourself from the result. For a doctor trying to save someone from a heart attack, this means pouring all their focus into doing the protocol perfectly, instead of being frozen by the fear that it might not work. It's about giving them a mental framework to find stability while they practice medicine. So what's the big idea here? What's the ultimate goal of all this? Well, it's about completely changing the experience of being a doctor or nurse. It's not just about treating patients better, it's about fundamentally changing the well-being of the healers themselves. And this quote just says it all. The goal isn't making a choice between being a fantastic doctor and being a calm, centered person. The whole idea of code wisdom is that you have to be both. It suggests that true excellence in your work and your own inner peace aren't separate things. They're totally connected. So how does it actually work? Well, the path starts by looking burnout and moral distress right in the eye. Then, by taking the Gita's wisdom about duty and pairing it with those modern medical protocols, the hope is to get to a whole new kind of outcome. A healthcare professional who is at the absolute top of their game, but without burning themselves out to do it. And at the end of the day, that's what's so powerful about this whole thing. Modern medicine has all these amazing tools for healing patients. Code wisdom is like a new kind of tool, but this one is designed to heal the very people we count on to save us. It's a powerful reminder that you just can't pour from an empty cup. And that just leaves you wondering, right? If this incredible blend of ancient philosophy and modern science
can help solve a crisis in one of the most stressful jobs on the planet, what else could it do? What other really complicated modern problems are out there that might have answers just waiting for us, hidden in the wisdom of the past? It's a pretty amazing thought.